Hey, this is Ash from Dentistry, the place where we're passionate about sharing those unwritten hints and tips of dentistry. Well, you didn't come to see this, and if you don't know what this is a direct pattern for a cast, post, and core. I even have trouble saying those words because it's been so long since I've used them. I'm super excited about this video because I've been able to capture some great video with the help of my amazing dental assistant. And now the reason why I was able to capture that is because we removed all the composite that was on this tooth. It was many, many years of composite buildups. And we've finally gotten to the point where we need to remove the fiber post. This is where we're headed. We're making a cast post and core. Now, yes, this is old school. Yes, this is the last legs of this tooth. Yes, we may need to ortho extrude this tooth. And yes, we may need to crown lengthen. But with all that aside, I'm very grateful to present to you one way to remove a fiber post. Let's jump into it. Let's tackle this fiber post because there's a lot of times when you want to try to get a fiber post out, but it's a little bit scary because how do you get that thing out of there? Well, this is one way. And let me show you a couple of tips that I use. So the things we're using. This is the size. Let's back up here. So I'm really excited. Sorry. So this is the fiber post right here. You'll see more of the extension of the size of it. I'm using a purple Muntz burr. That's like a half round, I think. I'll have to check. Put in the comments. I'll put it in the comments below. Small Muntz burr. And then I have actually a stropical irrigator. Now, if you're not familiar with that, you'll see it down the road, and I'll put a link in the description box below. You'll just take a look at it. And those two things together really make the difference. So you can see here's the outline of the post. A lot of different posts out there. Some light up, meaning they're more visible when it's cold versus warm. Some are different colors. These are just regular, straight, standard fiber posts, and they're really hard to see. So you may have to use water versus dry. That's what we're doing. I actually was fortunate not to do that here. I forgot to mention that this post is roughly about 10 millimeters deep, and I think it's an endo sequence post. I'm not sure. It doesn't matter. They all pretty much do the same thing. And the reason why we need to remove it is to develop a larger kind of, if you may, monolithic gold post in there to kind of hold everything together because everything fractured actually around the post. So let's take a look here. So try to get it right about that. There we go. So this is the post here. There's a little bit of composite remaining here. You can see that one of the things that we're looking for, and I ask you, if you're going to try this, please use an extracted teeth or a few of them before. And these require a lot of magnification. And because we're at 6 times here, it's really easy to perf. And we're using a small Muntz burr to prevent that. Now, there are a bunch of drills out there you can use, which are super helpful. Get your hands on them, try them, but just practice on extracted teeth. So this is the outline. These are a couple of things we're looking for. That white line, just like doing MB2, you're looking for the white line or of a missed canal. See that white line? That's kind of the delineation that I'm looking for between tooth structure and composite. Oh, see, the post is even bigger. And I just did this recently. So we're slowly removing the composite post, and using a smaller burr gives you a lot more tolerance. There's a lot more room for little mistakes here and there, rather than using one large burr and that's it. You go one way and it's hard to kind of come back the other way, if you know what I mean. So these Muntz burrs have a really long shank, so it keeps the head of the handpiece out of the way. And then the beauty of this is my dental assistant is blowing air with this tropical irrigator. We have like an etch tip. See this little thing hiding in the corner here? It's able to direct air straight down onto there and blow out all that debris. So at some point, unfortunately, what happens is you get deeper down in the canal, and then you'll see I kind of have to stop, and this is pretty normal. I have to stop and then kind of make sure my angulation is correct. And then I'll do kind of like little pecks. I'm pecking at the post. Let's do that. Post pecking. Let's call it that if you want. So here what happens is as you can see, I can't see what's going on. So it really comes down to the proper angulation of my handpiece. Now, I am looking from the buccal, and I am looking from, not through the microscope. I will look through the buccal, outside, just to make sure I'm down the right kind of path that I'm kind of guesstimating at, just to make sure I'm on the right path of the post. And here, as you can tell, this is the post. So it lights up, it's so easy to see when it's dry. These posts anyway, sometimes it's really tough. It's like removing composite from a preparation. Sometimes you can't tell composite from tooth structure. So sometimes it's difficult like that. So let me go back here. Sorry. This is a stropical irrigator. It's a really useful tool. I find it's only useful for this in my hands. I've had this for 10 years in my drawer, and I finally pulled it out and was like, hey, let's try it. And wow, what a difference. So what I'm doing is we're doing a two-pronged approach. I'm going to do a couple pecks. She's going to blow it out, and look at that. Boom. So we went through about 10 millimeters of post, maybe 8 millimeters of post. It took a little bit of time, and that was it. So longer posts have taken me certainly much longer, but it's really the access and making sure everything's clean and taking that systematic kind of approach. And then from here, we really didn't need to redo the root canal. We're just going to create that cast post preparation. Anyways, I'm so grateful you're here. Thank you so much for joining me, and we'll talk to you soon. Hey, Ash here, and I wanted to take a second of your time just to introduce our course, Root Canal Like an Endodontist. We've had it for a couple years, and we've had some amazing successes through it. Just confidence building on behalf of our students. And really what happened was a few years ago, I wanted to create a course to help others because I know what it's like on your endo journey. A lot of times you don't know what's going on. You don't know if you've ledged it. You don't know what to do if you blocked it. You don't even know if a curved canal, what to do. And what I wanted to do was take all my mistakes and my training from my residency and put it into a affordable online course for everyone around the world to join in. And it's been absolutely amazing. And I wanted to offer to you, check us out at allthingsendo.ca. Once you join the course, you get access into our private Facebook group where all of us answer questions. And I'm telling you, there are questions every day that you might be able to, I'm sure you'll be able to connect with, because sometimes it just takes a little bit of courage to ask a question and then your outcome may be incredible. Anyways, I look forward to seeing you there. allthingsendo.ca. We'll talk to you soon.